Hello, my name is Brian. I'm a family nurse practitioner student at Saginaw Valley State University. I'm going to be doing a brief assessment on you. So first I'm going to check your right side for your venous jugular pressure. I don't see any venous jugular distension. Next I'm going to have you turn your head to the right. I'm going to use tangential lighting here, and I'm going to check for your point of maximum impulse. Alright, it is noted in the lower 1/3 of your neck. I'm going to have you look this way, and I'm going to do the opposite here. Is noted on that side in the lower 1/3 as well. Next, I'm going to get measurements here. I'm going to measure your jugular venous pressure. So that's going to involve me putting this ruler on your sternum. No, excuse me, not sternum, clavicle. And then I'm going to match it up with the PMI here. And we're at 1.5 centimeters, which is below the 3 centimeters that would indicate some sort of health problem. So now I'm going to palpate your carotids. Sorry, 2 fingers on this side. All right. It's brisk. It's just this tapping sensation. I would say it's 2+. Also noted the same on that side as well. Next, we're going to find your point of maximal impulse at your apex. So I'm going to feel, we have first clavicular notch, second, third, fourth, fifth. So in between the fourth and the fifth, we're going to go to the mid-clavicular point here. And the PMI is felt right here with 1 finger. Next, I'm going to go back to the third. We're going to feel this, which is Erb's point. You can feel a pulse there. Fourth, which is the tricuspid. And then fifth, which is the mitral. Next, we're going to go up to the second, which is the pulmonic. Palpable pulse is there, and then we're going to go to the right sternal border on the second intercostal space, and that's the aortic. And that is palpable as well. We don't have to do percussion because I was able to feel the PMI. Next, I'm going to take a listen to your carotids for bruits. Alright, no bruits were noted. Pulses sound equal and regular on both sides. Next, we're going to use the diaphragm, and I'm going to second intercostal space on the right hand side, which is the aortic. Second intercostal space on the left side is the pulmonic. Third intercostal space left side is the Erb's point. Fourth is the tricuspid. Fifth is the mitral. And between the fourth and the fifth, mid-clavicular line is the apex, or the PMI. S1 and S2 were heard throughout. No abnormal heart sounds or murmurs were noted. So I would switch from the diaphragm to the bell. My stethoscope does both functions, you just have to press it harder for the bell function. So we're going to go back to the apex, which is the fourth and fifth intercostal space, mid-clavicular line. All right, and then we're going to move to the left side sternal border, 5th intercostal space, and 4th intercostal space. All right, no extra heart sounds were heard there. No murmurs. So what I'm gonna have you do is I'm gonna have you turn to the left and left to cupidus position. Dicey, I'm gonna need you to move just a little bit there. All right. I'm listening to the apex, once again seeing if I can hear S3 or S4 or any sort of murmur of mitral stenosis. And none are heard. So what I'm going to have you do is sit up and lean slightly forward. And then, not sure I'm here. I'm going to listen along the 3rd, 4th, and 5th intercostal space as well as the apex on your exhalation. So breathe in and then breathe out. All right. Once again. Sorry, Dave. And then on the apex. All right. No extra heart tones were heard. S1 and S2 are able to be heard again at varying frequencies depending on the point I was listening to. But do believe that is it.